What's up, you guys? It's Bob Miguel giving you your daily dose of radiation. In today's video, we're covering what is the protocol / to expect post open heart surgery or post surgery for X-rays wise. So, I'm an X-ray tech. I've been doing it for 4 years. I work night shift at the hospital. Work a lot of overtime, so I do dabble in day shift. So I'm pretty well versed in both worlds. So there's a place in our hospital that we call, like, there's the same day surgery. There's the surgical ICU. So those are people who usually come out of surgery and they're like open heart, post cabbage, post what, mostly because this is America, majority of the time it's like a bunch of heart issues we have that come in, and like there's other surgical operations that people get, but the main one is like the heart one. I mean, we're not a heart hospital, but that's like because America, you'll deal with that a lot. So usually they'll call us, they're like, hey, we have someone post-operation, post-cabbage, post whatever they call it. We need you to do a chest x-ray. So usually, on day shift, because it's different at night, on day shift, when they call us, and I've done it many times at the very beginning of my career, because I ain't know, and there's a bunch of us who are newer, would go right away. And what would end up happening is we would sit there, and like literally, I'm talking about fresh out surgery, like literally, the surgeon was still there, like the other nurses were swapping between like the surgical nurses to the other like nurses in the intensive care unit were still there, and we were like waiting between like 10 to 15 minutes because they had to stabilize the patient, get everything done, and like over time I'm like, well, if they're gonna call, how about we wait a few minutes and then we go up there? And what would end up happening is like that would cut down on the wait time, or we would knock out other stuff and then go up there, unless they would call us saying, hey, they're also putting a central line, or they're doing this and that. Then that could either add, like we would ask, is it already done, or they're going to? Because at night shift, because there's only 2 of us, and like the nurses know like the game now, well, at least the older nurses who've been there longer know, like there's only 2 of us. Usually we're pretty busy, so like when they call us, it's because like they're like about to finish, or they're like, hey, he about to start one, 10-15 minutes, head on up. And we're like, we already know the game, or sometimes they're like, hey, I'll call y'all again when it's ready, we'll put it in, but don't come up yet. And we're like, okay, because in the ER happens too. If they're gonna intubate, they're gonna do something, some people call us and give us a heads up. Other people will just call us when it's ready. So that helps a lot to cut down on just being there just waiting when other people, or like you could be doing other stuff, so that could help. But usually it's just a chest x-ray that we do to look at usually the placement of the heart, lungs, chest tube, or whatever situation the patient has going on. Or sometimes what will happen is since they're intubated, some people are intubated, and we'll check for like NG-OG tube placement of the tube. That is something that happens. So usually it's just a chest and like an upper KUB. Occasionally, if like they're like extremely bloated or have other stuff going on, you may shoot like a full KUB. But usually that's about it. Usually in those places, that's all we get. Occasionally they'll order follow up on extremities or follow up on other stuff if they've had, like MBC or something else major going on. Occasionally we'll do something like that. But usually by the time they're at that point in the hospital, all the x-rays kind of already been done in the ER or other stuff to rule out fractures or whatever the patient has going on. So So, but that's kind of what you can expect for patients who come out of surgery. And yeah, it's been your boy Miguel. See you on the next one.